Thank you all for attending today's event. Thank you to our dear panelists. So we apologize that the supposed to be big event we prepared weeks ago. We have this format now because of the declaration of suspension of classes yesterday by our mayor, and for the COVID 2019 also. Nevertheless, as according to Dean, we see this as a positive opportunity for us. So to have this, to showcase a different form of showing public forum, still following the DOH advisory of avoiding mass gathering and practicing social distancing. So sabi ni Dean, pwede pa rin kahit na hindi mahaharangan ng sibat. Okay, so welcome and good afternoon, and thank you to our panelists.
Unfortunately, our Chancellor, Carmen Sita Di Padilla, won't be able to make it to this afternoon's panel discussion. She's with the rest of the UP Manila officials discussing measures for the COVID 2019, for the measures that the university will be implementing. Okay, so this event is a panel discussion with representatives from the government, from the public health sector, from academia, from non-government organizations, civil society, and co-hosting organizations. This panel discussion will go online via webinar, so you can catch us by accessing the link tinyurl.com/womenph. So for those who are catching us live now, please share the link through your social media sites so that more people can join this discussion. So this event will explore gender mainstreaming strategies in public health in the Philippines, and it aims to do the following. So first, inform current and future public health professionals about gender and gender inequality as determinants of health. Stress the importance of gender equality and how this has strengthened health and community systems. Lastly, highlight gender equal perspectives and best practices in different areas of public health, policy development, program management and administration, human resource planning, service delivery, management information systems, and accountability.
Okay, so thank you, Harvey. Let's start the ball rolling by introducing our moderator for this afternoon. So this afternoon, our moderator is a professor of the Family Medicine of the College of Medicine, University of the Philippines, Manila. She is our dynamic center director for the Center for Gender and Women Studies of the University of the Philippines, Manila, and which CGWS aims to institutionalize gender-responsive health service and health policies, as well as to develop gender-sensitive curriculum and teaching framework for constituent colleges within the campus. So last March 2, we had our opening ceremony for the month-long celebration of Women's Month here in the University of the Philippines, Manila. And this is our contribution, the College of Public Health contribution to CGWS UP Manila. So thank you. So may I now introduce to you our moderator, Dr. Lailani S. Apostol Nicodemus.
Thank you so much, Evan, Harvey. That was a wonderful introduction of this very innovative way of conducting public forum. And I think we utilize social media for that purpose. Okay, so I would like to introduce to you our esteemed panelists for the Women 2020 conversation, Women in Public Health. So let me start with our Honorable Senator Risa Hontiveros. Our guest today is Senator known for her tireless work in promoting public health and women's rights and the welfare of the Filipino family. Senator Risa is a multi-awarded public servant, community organizer, and journalist elected to the Senate in 2016. Just halfway through her term, she already championed 14 landmark laws, including the historic expanded maternity leave law that gives working women 105 days of paid maternity leave, and the Philippine Mental Health Law, the country's first ever national policy to care for Filipinos' mental health. As chairperson of the Senate Committee for Women, Senator Risa also authored the Safe Streets and Public Spaces Law, or the Bawal Bastos Law, that protects all Filipinos, particularly women, from gender-based harassment in the streets, public transportation, schools, and the workplace. At present, Senator Risa is working to expand the Solo Parents Act to further help single moms and dads in providing for their families. And also, our senator is also pushing for increase on the monthly pension of senior citizens through the Lingap para kay Lolo at Lola bill. Even before becoming a legislator, in 2005, she earned a nomination to the prestigious Nobel Peace Prize for her work in the peace movement. Despite her busy schedule, our dear senator is a loving and hands-on mother to 4 children, Kiko, Yana, Isa, and Sinta. So let's us give a warm welcome to our dear Senator, Risa Hontiveros. Our next panelist is Dr. Gawrie Galappaththy. Dr. Gawrie is a medical doctor from Sri Lanka with more than 20 years experience in planning, monitoring, implementing malaria control, elimination activities in the National Control Program in Sri Lanka under the Ministry of Health. She is currently working as a medical officer, team leader of Vector-Borne and neglected tropical diseases in the Philippines. Prior to this appointment, she worked as a medical officer, Malaria Elimination Unit, Global Malaria Program, WHO Headquarters, Geneva. She also worked as a team leader on malaria, other vector-borne diseases, and parasite diseases at WHO Country Office, Vietnam. Dr. Gawrie joined the WHO since 2012, initially at Myanmar. She holds an MS and MD in Public Health from the Postgrad Institute of Medicine, University of Colombo, Sri Lanka, and Liverpool School of Tropical Medicine and Hygiene, United Kingdom. She is an expert in malaria control and elimination, malaria surveillance. Another esteemed panelist for this afternoon is Dr. Ruby C. Constantino. Dr. Ruby Constantino is from Tacloban City, Leyte, and then she moved here in San Rafael, Bulacan, where her family resides up to the present. She is married with 2 children who are all working now. She took her medicine at the Remedios T. Romualdez Medical Foundation in Tacloban City. She had been in the government for 33 years, 13 years of which was spent as a resident physician in an LGU hospital in Bulacan, and joined the Department of Health in year 2000. She rose from the ranks and had been assigned to different regions, namely Region 3, Region 9, Region 4, and to the central office in 2018. On March 2019, she was appointed as a director assigned at the Disease Prevention and Control Bureau of the Department of Health, handling the Family Health Office and the Environmental and Occupational Health Office. So please welcome Dr. Ruby Constantino. Another esteemed panelist is Marvi Trudeau, a Deputy Executive Director of Pilipinas Shell Foundation. Marvi spearheaded the malaria program in Palawan in 1999. With Global Fund support, the successful program in Palawan was expanded to support the National Malaria Program, which substantially contributed to steering the country towards elimination of malaria. At the end of 2019, out of 81 provinces of the Philippines, 60 have been recognized as malaria-free. Thank you so much, Marvi. And 18 have reached 0 and are still waiting malaria-free declaration, leaving only 3 still with local transmission. Marvi represents a foundation as a partner institution of APLMA. Marvi received her degree in AB Social Science from UP and MA Business Management, International Management at the International University. She also received certifications in Bridging Leadership at AIM and the Science of Eradication in Harvard. So let's welcome Marvi to our panel. And lastly, Ms. Charisse Jordan, who is now the National Project Coordinator of UN Women Philippines. Welcome, Charisse. Yes. Hello. Okay, so these are our esteemed panelists. So we'll now start with the discussion. And it's very exciting because they bring in their strength as women who now make sure that gender is included in the programs that they're doing. So that's what we're going to understand. Let's hear from them. How can we make gender be included in the activities? We call it gender mainstreaming, but we opted to use inclusion because it's more understandable, especially to our audience outside. All right, so may I start with you, Charisse? Okay, trying to look into the advocacy and probably understanding how we can contribute in terms of the global gender gap in reducing that kind of gap in the world. Because we went top 16 among the most gender equal countries globally based on that report. We still have things that we need to do. And I know you're working on, especially on gender spaces, which is a new concept that probably, like our institution, we might want to learn from you. Can you talk about your work?
Yeah, thank you, Dr. Good afternoon. Hi, Senator. Just to, of course, pay our respects and recognition without Senator Risa Hontiveros' really staunch advocacy for the Bawal Bastos law, it wouldn't really see the light of day. The UN Women started safe spaces, the anti-catcalling ordinance in Quezon City. But that's it for sexual harassment and sexual violence in public spaces. I understand that this is a forum about health, and of course, when we talk about women and gender equality, we look at how the health sector and the health system would address the gender differentiated needs of women and girls. Every time we have discussions about public health, public policy, the first question in mind would be, this is inclusive for all, so why the special attention to women and girls? And isn't that also discriminatory against men and boys? And of course, I don't have to belabor the point that one of the Sustainable Development Goals is SDG 5, which is on gender equality. And it's already not new news to us that gender-based violence, like 1 out of 3 women experience violence at least once in her lifetime. So what is the connection between women's issues, women's health, public health, and nation building? Why do we talk about gender equality when we talk about public health? And I may want to zero in on 3 points. One is, we cannot talk about public health if we don't talk about gender inequality. We cannot say that our society addresses the whole of the needs of its peoples when some sectors are left behind. So that's one. We cannot talk about public health without talking about gender inequality, because obviously, there might be some sectors that are left behind. Number two, when we talk about gender inequality, we talk about discrimination, marginalization, and gender-based violence. And I know this might be a heavy concept, or I guess 3 heavy concepts. Let me start with marginalization. When we talk about public health, for example, in the headlines would be understandably the COVID virus, correct? But who are accessing these services? When we say who are accessing these services, we would say, oh, but the services are readily available to everyone in the public. But who would first attend to their families, then go to the hospital? Who would first attend to her children and would first put family as her priority, then taking care of herself? And so we talk about marginalizations. Who is in the margins? And every time I would address forums like this one, it's so easy to say who's left behind. Let's look around us, who's not inside the room. Where are the people, women and girls with disabilities? How can they access health services? How can they access, for example, immediate support if they happen to be having symptoms of the COVID virus, for example? Second, therefore, when we talk about margins, we also have to relate it to what constitutes women's health. Do we talk about women's bodies the same as men's bodies? Do we say that all men and women are simply the same? Unfortunately not, because women, we talk about sexual and reproductive health and rights, women's bodily integrity. And when we talk about women's sexual and reproductive health and rights, sadly, some parts of the authorities would say, oh, that should wait. Why are we talking about contraception? Why are we talking about abortion? And even to some, when we just mentioned the word abortion, they would say, oh, we don't have to talk about that. But why, right? According to UNFPA, 2,400 women and girls die from preventable causes related to pregnancy and childbirth. And yet we say, oh, that could wait, right? So whose issues are in the margins? Second, discrimination. When we talk about gender-based discrimination, we look at, again, how women's bodies are seen, viewed, and treated. So my program right now is about safe and fair, realizing women migrant workers' rights. And when we talk about the health of women, as it affects women migrants' health, I would always ask, and this is quite a story that hit close to home to me, because I'm also a survivor of sexual assault. And we would ask about, what about services for mental health? We have known that in the headlines, when we talk about OFWs or overseas Filipino workers in distress, who makes the headlines? These are often women migrant workers, many of them domestic workers, whose body was in the freezer, who was raped. And how are women's bodies viewed that seemingly there seems to be a sense of entitlement where people can violate women's bodies. So when we talk about discrimination, how do we also see the interrelation between sexual violence and women's bodily integrity? Why do we have to explain ourselves what we were wearing when we were sexually harassed or catcalled? Why is it when we talk about, for example, rape, they will have to ask about, what were you doing, right? So seemingly there seems to be a difference between how we treat women and men's bodies. And seemingly there is, evidently, I would say, discrimination in terms of women and men's health and we say bodily integrity. And that also drives me to the last point about gender-based violence. Because yes, not only about mental health, which is severely neglected, I would say, and also stigmatized. Like dito, we just had a roundtable discussion with psychologists and social workers, and we don't even have a Filipino equivalent for mental health. In the communities, we call it nabaliw. And even in women migrants or OFWs who say, ay ma'am, nabaliw po kasi yan, kasi na-rape po. We don't even talk about post-traumatic stress disorder. And if people go to seek help for therapy or professional help, there is a different treatment to them by the community. And so why is it that when we talk about gender-based violence and mental health, we never talked about how it should be normalized, that people, one, should not commit violence against women, should respect women's bodily integrity. And when we talk about health, we should not marginalize issues such as abortion, and I'm saying it now because we need to normalize this discussion, sexual and reproductive health rights, bodily integrity, mental health, and also, my last point would be, nandito si Senator, so medyo maglalabi ako, there is an ongoing anti-rape amendment. And imagine, make a guess, how health should figure in the ongoing anti-rape amendment. Yes, mental health is one. Treatment interventions for PTSD and trauma, yes, indeed. But I was asking just a few days ago, kasi UN Women kami, right? So people, although we are UN Women, we look particularly into ensuring compliance with human rights and women's rights standards. But people would think that we have the networks, correct? But we are not a service delivery organization. United Nations is not a service delivery organization. But people, women and girls approach us. 2 weeks ago, a woman, a lesbian, was raped. She was, and it was her first sexual intercourse with a man. Again, I'm speaking this because we have to normalize these discussions. We don't have to hide it under the rug. And I said, okay, please go to Women and Children Protection Unit, WCPU, because they should have a sexual assault or rape kit. The rape kit should have, according to WHO standards, special for sexual violence, 1, emergency contraception, 2, post-exposure prophylaxis for HIV. At least we can lessen that worry, diba, from a traumatized survivor, right? Unfortunately, she went to WCPU or certain, I will not mention which police station, and they said, so that night when it happened, she went there, she got her statement, and then the following day I said, did they offer you a sexual assault kit or rape kit? I said, no, ma'am. Oh, maybe you should ask, maybe it's available. So she went back again, imagine that. She went back to the said facility, and then I spoke to the captain, and the captain said, ma'am, nag-provide na po kami ng rape kit. And I said, how exactly did you provide, the service? Ma'am, may swab na po. Friends, alam na natin yon. But when we talk about emergency health services and emergency facilities, unfortunately, some of our supposedly authorities are not open to discussing emergency contraception, not even post-exposure prophylaxis. These are not available in the Philippines, it's at least not regularly provided by our supposedly institutions that should be providing them. So now that there's an ongoing anti-rape amendment, and even when we talk to our different government offices, the first question would be, we don't have a policy basis for that. And I think perhaps that's why we're here now.
Okay, yes, thank you, Charisse, for sharing that. It's really wonderful. And I think just probably to put that in perspective, can I request for the video that would be shown before you that would really look into, and it resonates what you have mentioned, Charisse, about gender-based violence in our problem in providing for appropriate health services when it's needed. Okay, in fact, actually, we have here in this institution women's desk, and we also have CPU, and we receive patients who are like this. I don't think, policeman would talk about this kind of services. I think it's more on our end as healthcare providers who are knowledgeable in discussing, communicating these kinds of intervention. And your point there, saying that mental health for these kinds of violence is not really looked into. So the impact of that kind of perspective about yourself being raped is not really discussed also in mainstream. Okay, so can we watch now the video? Okay, that's a very nice perspective. It's really connected to what you have mentioned about unequal health services and even access to health services. So my next question is directed to Dr. Ruby because as mentioned about health equity, universal health care had been passed into law in 2019. And probably we would want to hear from you in terms of the Department of Health's perspective, what services will be included in the universal health care that would look into women's health or access of women to essential services for that matter. Can you share some of your views about this, Dr. Ruby?
Thank you very much. Good afternoon, Senator Risa and the rest of the panelists. Actually, the passage of the Republic Act 11223, which is actually the Universal Health Cover Act, illustrates the commitment of our country in making the health services universal. And to make it universal and transformative, it must embrace gender equality in all forms. So our model always, when we talk about universal health care, is both Juan and Juana should receive the same services. This means that regardless of age, sex, socioeconomic status, race, ethnicity, or even sexual orientation, and following the principle of gender and equality and equity, every Juan and Juana should be able to access the essential health services without the risk of impoverishing themselves. As we start to implement UHC, actually this year, we are now, the Department of Health, each bureau are now assigned to implement the UHC. So for example, our bureau is assigned on the development of policies on the primary care packages. We need to consider inequities and disparities within, across groups and geographical areas in accessing healthcare. Therefore, there is a need to learn how gender norms and unequal power relations impede access and identify the key barriers to access for women, men, lesbian, gay, bisexual, transgender, and even what we call the intersex populations. So LGBTI. A first step, of course, is to assess the central role of our health workforce in an equitable health system, not only in the supply and distribution of health workers, which influences access and equity, but also the gender composition of the health workforce, which can influence acceptability. So there should be a gender equality in the health workforce, not more of women, not more men, but equal. Also, one of the initiatives of the DOH is the institutionalization of mainstreaming gender and development perspective into all our DOH programs, projects, plans, and activities. In fact, several gender training activities have been conducted by the DOH as part of the in-service training programs for the current health workforce. To break barriers towards more gender-responsive and equitable health system, Inclusion of gender-sensitive and inclusive in education and training of our future and current health workers is very important, as they will be the frontliners in the delivery of the health services. Hence, we are requesting that the academe is instrumental in honing competent and gender-responsive health professionals in the future. I therefore pose to everyone a multifaceted question: what are we preparing today's medical, nursing, and other allied health professional students for? The promise of UHC can be realized once we consider the unique health needs of women, girls, and marginalized communities, recognize the distinct role and contributions of women in the health workforce, and promote women participation in health leadership and governance. Before I end my message, actually yesterday during our flag ceremony, one of the question, because every time we have a flag ceremony, the host office would have some games. And one of the question during that game is, can you name the very first female secretary of the Department of Health? And then, can you say how many are the female members of the OXICOM? So we are really after gender equality, even in our managers, even in the OXICOM. So thank you. Even if our WCPU units are in the police stations, usually female are the one attending to these clients, and they are also trained in handling these clients.
And I know you're excited to hear from her, our dear senator who is a champion for women, and she made a lot of laws that would reflect her advocacy to espouse women's rights.
Magandang hapon sa iba ko mga sisters dito sa panel. I'm sorry, Dr. Gawrie. Do you speak Filipino? Okay, I'm sorry. Okay. Okay. Oh dear. Here we are talking about inclusion, sorry. And Doc Belly, Micah, all the participants in this webinar, in the room and online. Well, off the top of my head, aside from the laws already mentioned by the other speakers, for example, the anti-rape law, which we have a bill now to amend. So I wrote down my homework to include health in the amendments. The mental health law also mentioned. Off the top of our heads, we can also think immediately, for example, about the newly passed cancer law, on which a lot of women advocates work. Women, cancer survivors, cancer warriors. Even when we talk about the mental health law, which we also passed last year, when we think that women, I can't see my numbers down here, but women supposedly we suffer double the numbers than men in terms of unipolar depression. And there are other mental health conditions that are, if you think also about postpartum blues, that is a mental health concern also of women after we deliver our babies. It almost couldn't be helped that there should be a gender perspective and a women's perspective, even a feminist perspective in the passage of the mental health law. Then, of course, always the proof of the pudding is in the eating. So we have to make good our intentions as women and as feminists, women and men, both of whatever. So, thank you, Doctora, for that, in the implementation of these and the other laws that we've already passed or that we are still working to pass. And I also was really caught, Doctora, by something that Charisse said about rape kits. The other week, I had dinner with 2 young alumna from my alma mater, that other university on Katipunan Avenue. And these included, these were 2 young women who worked a lot on the anti-sexual harassment policies, very young still at the Ateneo. And I remember one of them said, you know, one time a friend of mine came to me because she had just been raped and she wanted to find out which public hospital had rape kits. So this young woman I was having dinner with, she said she Googled and she was already on page 11 and she couldn't find. I said, oh my God, you're so patient. When I'm at page 3 of Google, I stop looking if what I'm looking for it doesn't seem to be there. Now, a few days later at the Philippine Art Fair 2020, this kind young couple let me sit with them in the coffee shop. And it turns out the woman is a doctora from here, from UP College of Med. And I got to talk to her about this rape kit. And she told me that, in fact, what the young alumna and I were talking about, were wishing to work on, is already available at the UP-PGH emergency room and hopefully a few others. What we were talking about was that so that a rape kit is available, so that something that is equivalent to a medical legal report is available, can we maybe spark a partnership between DOH and DOJ and UN Women? Sorry, I was just talking about the government agencies first. Thank you for the international, intergovernmental agencies. But for starters, DOH and DOJ, maybe with the PNP, Women and Children Protection Unit, to place in every, at first, even if at first just the government, public hospitals, ER, a rape kit, which will be accepted if the woman wants to file charges, or the man, for that matter, in the minority of rape cases, wants to file charges, that it is equivalent to a medical legal report. And of course, the hospital staff, whether a nurse or whichever ER staff to administer this with the survivor, is also trained, is also oriented how to walk the victim survivor through this. So, sorry, I spoke more about that, but that's something very practical that we can work in, both to our laws and to the programs and services that these laws are supposed to usher, responding to very concrete needs of women in terms of our various health needs in the country.
Thank you, Senator. I think that's mind-provoking. Actually, we have been providing services. Well, I have a bias because we work in PGH. Women's Desk is very active in espousing these kinds of services. But I think what is lacking is more on training, which is you have said and mentioned about capacity building of health professionals, not necessarily physicians. Because I think that's a problem. If you just leave the knowledge with physicians, you have few who would now be probably serving a facility, government facility out there, far from the city. So I think that's what needs to be done, Doctora. So that's a very nice suggestion, Senator. And I think if there would be now inclusion in the anti-rape law, I'm not cognizant of this law, about these services that including training of health professionals, so that there will be timely services for our women, or all gender who receive harassment for that matter. Okay, so in terms of, pasensya na, Senator, financing health services, or looking at allocation of finances for these kinds of programs, is it easy to espouse, or are there magic tricks that probably we can do? I was talking with Janice about God plan and budget, and 5%. It's a huge money, but it's so hard to allocate and access it. And then I was saying I would be more interested on the outcome rather than just putting the numbers there. So how's your experience, Senator?
Well, Ms. Janice could probably tell better than me, but really the appropriation in our administrative law, about 5% of every budget, of every, as in every government agency and unit, from the local to the national levels, across the 3 branches of government, mandated by law for gender and development. And not just what we're accustomed to, the traditional beautification programs, but practically anything and everything that women's and feminist and gender-sensitive organizations could apply this appropriation to in terms of increasing gender sensitivity and gender justice in our society, and engendering sustainable development programs. So that would then include all our targets under the previous Sustainable Development Goals and moving into our Millennium Development Goals. And the same goes for our health-focused laws. Just thinking about the Universal Healthcare Law, which was shepherded on the executive side by the Department of Health, all the way to their months-long consultations in all the regions among different sectors to come up with the implementing rules and regulations. It was very inspiring for me as a legislator to participate in that, because even when my office started to work with the advocates and DOH and other government agencies on the law, we really used the template of the World Health Organization. How can we Filipinos set up a universal healthcare system? So with those 6 pillars, including, of course, health financing and health insurance. So the critical role of PhilHealth to make quality healthcare accessible to all Filipino families through a more well navigated public health system without the threat of financial ruin. So there's the General Appropriations Act every year, where we ask the guidance of Department of Health, what are the programs and activities that should be prioritized in terms of appropriation. And then in health-specific laws, like I mentioned, the cancer control law, there was an appropriation there. The mental health law, for the first time, also makes an appropriation for mental health programs. And the universal healthcare law itself says that, recognizes, aside from health promotion, which is one of the less familiar but should be internalized pillars of universal healthcare to citizens, to non-medical professionals, the universal healthcare law recognizes health financing, health insurance as an essential pillar. So, but as in any law, again, the proof of the pudding is in the eating, but the point is there are already appropriations there. So we citizens should know these are the services, these are the information, these are the health products available, so that we can access them. There should be no more problem about that there is money. Is it enough? That's what we need to work on in the coming years. But there are monies appropriated for health spending and for women in particular.
Okay, so that's good to know, our audience out there, that the laws now includes financial appropriation. It's more of how are we going to use that resources so that better health outcomes, especially on health, would be manifested, or as a manifestation of a good appropriation. So let me migrate to, because this is something that we have to talk about. Generation of data, it's a proof of concept. You know, as we now talk about outcomes, we have to look at how are we going to pull probably the data that we have, and then putting it forward so that health legislators or leaders would be convinced that these are the things that we need to do. And especially that gender equality is not really something being discussed in mainstream. So can we hear from Gawrie, Dr. Gawrie, in terms of your experience in a global health organization, especially WHO, in the interventions that you have participated in and lead? How probably would you put in gender in the census, big data, or what have you, and putting them together to show best practice?
Okay, good afternoon and thank you. And I'm very happy to be here because from a country who produced first female prime minister and first female president from the world. And in this audience, physically, we have more women than men. I counted. Thank you, Senator. First of all, I learned a lot from you also, because I'm new to Philippines, but not new to the public health, 25 years doing it. Let's go directly to your question. The problem of data. I think all of you know from our epidemiology courses why we collect data. Data collection for action. That is very simple thing. But there's a huge problem of data. Let's not talk about gender, maybe later, in a few minutes. Few questions. First, are we collecting enough data? Or we have collected more data and not using it. Those are in our files. Or we have parallel systems collecting the same data. So these are the problems. And I can take more examples from my field, malaria. I have 3 parallel systems, and dengue also. So we are with the DOH, we are WHO helping to have streamlined them. So let's turn to our main topic, the gender base. Now we have an outbreak, COVID-19. But in the Philippines, how many outbreaks? Starting from dengue last year, measles, polio, diphtheria, and now COVID. So you will get from the DOH website every day, if you go to even in your phones, you see number of cases. PUI, patients under investigation, confirmed deaths, this thing. Have you seen this sex desegregation or age desegregation? No. Do you think it's important? I personally think it's important. Because, as you have mentioned, the biology is different. Nobody knows how many pregnant women was positive in Wuhan for COVID. Because we all know that during pregnancy, our immunity is low. So then, why we want to know that? We want to give extra precautions, extra protection for those carrying a life. So that is the problem. Somebody can say that we have thousands, 3,000 cases, it's impossible. No, but I say it's possible still. So in the WHO side, there are so many documents, guidelines. Suppose now in polio, in dengue, because I'm looking after the whole dengue issue in Philippines. So we are getting disaggregate data by sex because we have found out more male children die due to dengue than female. So that is a biological difference. And again, more infants die less than 1 year, males, not the female. So this is the biological difference. So apparently found out that both, I have here, the similar health-seeking pattern between male and female. So if we are not analyzing sex-wise, this study was flawed, right? So this is how I think that is the importance of connecting data on gender. And the other side is, now when from the WHO side, we have 34 countries in this region, starting from big country, China, high economic, and the highly populated country like after China, Philippines, and small islands in the Pacific. So we all get together and we have a unit now separate in the WHO, gender mainstreaming and gender equality. And we have documents and we encourage the countries to share their success stories, right? So even for an example, if you want to have, say that you have a program and then you put an agenda. Those days we just put small item like gender equality or something. But now we advocate that you rephrase the agenda which help the gender mainstreaming and all the gender activities. So that is how we are advising. And I want to talk about the mental health. Yes, it was approved and WHO country office, Philippines, has taken a lead role to get this mental health. And I am happy the Philippine country was the recipient from the WHO headquarters, the majority of funding. And we are working on that. So just to tell you that we are progressing in that because it's very new to Philippines, and on the other hand, globally now COVID virus. We always reporting nobody is looking at the mental health aspect of the quarantine. Can you imagine 14 days? Tomorrow, if all of us asked to stay at home 14 days, what is your mental health going to be? So that is where it's coming. We have to be prepared for that also. I will stop there.
Thank you so much. Yes, it's as we go deeper in the discussion, there are a lot of realizations, and in fact, gender is not really just one. It will cut across, and you can follow same concepts. And probably let's listen to Marvi in terms of looking at partnerships, because in the university we have gender focal point person, and as a director I have to keep them intact, keep them inspiring. So how will you keep partners inspired and engaged? And you will be directed in one vision, especially on gender.
Okay. My program actually is Malaria, and that's the program that we started in Palawan in 1999. I am not from Palawan. My husband and I came to Palawan as a tourist, and we fell in love with the place. And then we realized that malaria is something like a common cold. Everybody has malaria. Rightly or wrongly, everybody who has fever claims that they have malaria. And so we don't really know how bad malaria is. But my husband saw an article one day, and it said that over 3,000 people are dying of malaria. And over 70,000 are probable cases of malaria. And so I went to see the governor, a private citizen. I went to see the governor and I said, everybody thinks of Palawan as malaria infested. What are we doing about it? I said, I looked at it and we have a few programs in barangays, maybe 5 barangays. Evido had a program, but we did not have a province-wide malaria program. And his answer to me was, wala tayong pera. So I said, if you allow me to organize the group that will make the program, I will look for the funds for you. Ang yabang, ano? But luckily, fortunately, Shell was coming to Palawan. And so I presented the program to Shell, my first partner. I presented the program to Shell, and I asked for 36 million pesos so that we can set up the microscopy centers in every barangay of Palawan and know for sure what the situation is. And so from there, what happened was, how do you spend 36 million when you have such a big, there were 340 barangays that were endemic of malaria out of 420. So when you have only 36 million, that's not enough. The 35 days of training alone will spend all of the money. And so what we topped was the mothers. Everybody is so involved in getting their livelihood. The mothers were there. Who do you want to have? The women in the communities were the ones tapped to be the partner in early diagnosis and prompt treatment. So the mothers were volunteers. We did not have to pay for them at first. And we made sure that they were capacitated so that they can be partners for a very important role in early diagnosis and prompt treatment. Everybody knows that if it's malaria, in 3 days' time, if it's really malaria, you'll probably die, right? And if it's Vivax, then you'll have 14 days of suffering. So having done that, having done the early diagnosis and prompt treatment, this actually was the pillar of the success of the program. Because then we went to see the barangay. These people are doing so well, can you please give them incentives? Then we went to see the mayors and the municipalities. Can you please give them incentives? I mean, they're doing so well. They're doing so many, I mean, they're in their homes, but they're doing the microscopy and diagnosis. And that's really thousands of people volunteer. And we wanted them to have something at least. And Shell also brought in livelihood component. And so Shell said, okay, if you are active in malaria, we'll give you capacity for enterprise development, and we will provide you some capital so that you can have something to tend for your family while you're doing the work. And so the whole gamut of organizing a community at a community-based level was something that we've done. And when the WHO came after 5 years to see, as an external evaluation, they said, and I remember this quickly, very clearly, they said that we have made the barangay microscopies part of the health system of Palau. And so that means that these people were already functioning, volunteers, mothers, most of them mothers, there were men also, about 70% were women, who did this and became the thing of success. We brought down the cases right away by 65%. By knowing the problem, by figuring out how much but of course we got the Global Fund to see us, and we applied for that grant. From 2006, when we got the first grant from the Global Fund, we replicated the success of malaria program in Palawan into the 5 provinces, the top 5 provinces of the country. And then it went into 40 provinces. And so now, as you said, there are, out of 81 provinces, 78 have reached 0. 60 of them have been declared malaria-free. And so it does not come easy because partnership is so important. For areas where we have challenges on security, we had to partner with the military. Areas of, or the INAMs, so that they can tell them to use the nets. Or anyone we could partner with, we partner with. Anyone who was there, NGO, civil society, we tapped them because we did not have so much fund to carry out nationwide. But of course, the Department of Health was always there. Without the Department of Health guiding us on the right ways to do it, the National Strategic Plan, we would not have done it at all. And so that partnership too had to be commended, because up to now, we're working together to make sure that the Philippines is finally declared malaria-free. You talk about partnership, I think you have to look at the weave of the partners that we have to be able to do it. But more importantly, I think when we talk of gender and gender mainstreaming, the same volunteers that we tapped as volunteers for malaria became barangay kagawad, councilors of the municipalities. They became so empowered that they felt that they were able to do much more in health than what they were doing before as housewives in the barrio. So I guess I'll stop there.
Wow, that's a very nice, powerful message. With and spirit of collaboration. And I think what's wonderful, what you said, is how you started in organizing people and mobilizing them. Yeah, you mentioned about women, but if together, there would be good collaboration, and I think you will achieve much as you have presented. Imagine that, 78 out of 81, almost perfect. We only have 3 more. So our goal is to have that done this year. Yeah. Okay, I think we should learn from you in order to address this COVID problem. Utilizing this kind of spirit, organization, because, you know, mobilizing people, learning how to empower themselves and have this understanding how to take care of themselves would be very powerful. That was so wonderful. I wish I can ask more questions, but I think we have to give chance to others before we probably would. Okay, so there's a phone-in question. Okay, so from the first, Okay, my first question is, where are, in terms of including transgender healthcare and or gender affirmative HIV care, especially for transgender women, in public health? So I think it's more on, do we have such now? How are we going? If none, probably how are we going to put in this kind of services for our transgender community in public health? Do you want to answer?
I was about to say the same thing. I was waiting for the final messages. I was like, okay, I take that in mind that, I'm going to mention that. Yes, indeed. We do have UNAIDS as well, working with, particularly on HIV response and prevention. And we have been also engaging with the LGBTIQ or persons of diverse SOGI. And unfortunately, it's a mix of, yes, we have the universal health care, we have the AIDS law, but unfortunately, in terms of access, this is what we're talking about, no? We may have policies in place, but in terms of implementation, as we were like whispering to each other, like Dr. Gawrie and I, and the implementation from the side of the government and also the access from the side of the citizens or the peoples, because again, we cannot assume easily that once the policy is there, it's being implemented, or even if we say that the services are there, that people can easily access it, especially those who are marginalized or discriminated against. Kasi mamaya, the system is discriminatory or is non-inclusive at all. So, and there are also some views, even from the government, when they respond to the LGBTIQ groups, including trans women, transgender peoples, including halimbawa, trans men, diba kasi the hormones, maintenance, etc. And they'd say, no, that's not public interest. See, we are talking about public health, and yet we leave out certain groups. We are leaving people, a number of people behind. Kasi ang sasabihin nila, they would always use that there is still no anti-discrimination law. Therefore, there is no policy basis. But yet we have universal health care, we have the anti-AIDS law. So yeah, I will pass it on to Senator Risa, who will know more about it.
Okay. Quite recently, Shell Foundation has been selected as the principal recipient to the Global Fund for HIV in the country. And during the last 3 months that we have been discussing the work plan and how we are going to implement this with the Department of Health, of course, we have looked into components where we are going to address concerns for the transgender. And so this will be part of the program, and this is going to be something that we will ensure that it is part of the, including, of course, other sectors, the young key population and the like, but transgender will be there.
Can I add before Senator to the last? Actually, the HIV program is not under me, but based on the experience, I can say that the Department of Health, we have the supply in terms of the services. However, to get the demand, like for example, for the transgender or for the members of the LGBTI, to get the services is a problem. And that is why when I was in the region, we noticed that we try to get these people to become peer counselors. So they are now the one that we trained, so that they are now the one motivating these people to come, have them tested and get the services. So that's based on my experience.
When Charisse was saying that the counter to advocates is because we haven't passed the SOGI equality bill yet, I wanted to say, so let's pass the SOGI equality bill. The community and all their allies have been pushing for this for 2 decades and counting, and includes prohibition and penalizing of discriminatory and stigmatizing behavior in all spheres of social life, including access to health services. But if we can't catch them right now from the SOGI Equality Bill direction to say that Of course, in any health law, whether it's the HIV/AIDS law or the mental health law or any health law, there should be no one left behind. If we cannot catch them right now from already a SOGI equality law, we can catch them from the universal healthcare law because it's called universal. So it means excluding no one. And hats off to the trans persons in the LGBTQI community who have been as active as all subsectors in the community to say that in each of these laws, they are a stakeholder and they have equal right to everyone in this access. If I could just add on what Dr. Gawrie was talking about data and sex disaggregation of data. Again, in that conversation with the two young alumni, there was a very concrete example why that is so important, where in the sense that if we do not sex disaggregate our data, it becomes all that more easy for women to disappear and to slip through the cracks. One of the young women is working on against trafficking just in our region, and she said there are so many horror stories of undocumented women. For example, Filipinas or Malaysian Filipinas in Sabah. They're no longer Filipino citizens, but they are, in a way, second-class citizens in Malaysia. There are women who slip into and out of sex trafficking rings in different countries in the region, labas-masok, in and out, and they don't exist anymore in our data. Nobody knows they're there, nobody knows where they are, nobody knows what their status is, their well-being, because there's no data about them. It's as if they cease to exist. So that's why what Dr. Gawrie was saying, whether about sexual health, in the case of trafficking and prostitution, or health in general, data is so important for women.
Can I add just exactly, this is the community where in Sabah, where we got polio cases. We got polio cases from Philippines because these are the second-class citizens in Malaysia. They were not immunized against polio. So that's the reason.
Yeah, so yes, these are realities. And actually, the UP system, for that matter, will pilot a transgender health clinic. We call it All Gender Diversity Clinic. We will pilot here in PGH because I think that's where we now generate this kind of data for health policy. We're striving and we will continue doing that.
Okay, so there's another question from Dr. Gia De Leon. So I think it's addressed to everyone. Do you consider your job a male-dominated profession? And as a female leader, what has been the most significant challenges in your career?
Actually, I've mentioned it earlier during my message that even in the senior level officers of the Department of Health, I think there are more women than men.
Local governments are doing better than national government levels. In terms of women representation, participation, and leadership. And then there are also differentials across the three branches of government. So similar in the private sector, where we women are very well represented in the rank and file, more and more so in the mid-level, and then a few pioneers, but slowly a few more and more following at the CEO and president level, but still having to smash that glass ceiling. That's very much the case in politics. Senate, we are 7 now in this 18th Congress. It's the largest number we've been in the more than 1 century of the Senate. So we have really a lot of catching up to do.
Are we in the male-dominated? Well, it's Shell, and therefore, I think there are. It was male-dominated, but I think if you look at the spectrum of the Shell employees now, there's much more women leaders, even in Global Shell. We have the country chair of UK, who is a woman, and when you talk of Shell, it's not just within the Shell. You can compete everywhere in the whole Shell world, and therefore, I think women have gotten far in showing that we can also do what they can. We can be good at what we do, and we can be even better because we have this capacity to look into more personal things, look to be more caring, to be more. I think that's a big difference. I mean, we were always stereotyped as being mothers, but we are more than mothers. We do much more, and we are able to do that mother job and be able to do other things that men do also. And we've shown them that we can do it. And as long as women strive to continue working hard to show that we have the guts and the intelligence and the capacity to do things, then we will survive.
I don't have figures talk about WHO, but if I take the Wipro region, so Western Pacific region, I think we are equal, men and women, and I have never felt any discrimination against me, because with my 25 years career, including coming from a conservative country, the Asia, so I don't think, but if you take Euro region of the WHO, it's more male, but we are okay, I think.
Okay, last questions. Last question, sorry.
Okay. How do we promote a more active role for women in public health issues? Women in the Philippines are the heads of the households, but how do we translate this to leading communities in health issues?
I think the example that I gave about tapping the women in the community, because they were the ones left behind during the looking for who will help us in this campaign. And then they showed that they became very successful, very compassionate, and very diligent in their work. I don't think we can ever reach where we are without the help of all of these women that have helped us set up the early diagnosis and prompt treatment. Not only that, but also the IEC. When people were thinking of, I said this in the last, when people thought that you can have malaria by eating pineapple in an empty stomach and or drinking buko, then you know that there has to be a massive information drive that was going to be done. And we tapped mothers' classes, we tapped the teachers, we tapped because they were the only ones that were there in the community all the time. Of course, we have weekend events so that we can get the men to be more involved. But the Mondays to Fridays, we only had women and children in the communities, and therefore we got them to be the ones that who became the advocates for teaching others what the real score is in getting malaria.
Can I add to that? If you talk about providing public health, of course, in the entire health system, 99% of our barangay health workers are women.
Let me tell you a story. As a foreigner, deep inside the forest in southern Palawan. Okay, she took me. I have to climb 2 mountains and cross rivers. You know who I met? A girl from indigenous population with 6 kids at home, children. We were able to train her to check blood for malaria diagnosis. And she's hardly able to read or write, but somehow we able. And this is, believe me, this is one of the success story. Madam, in the Philippines, not all are bad. These are the good stories. You should come out. This is first time. I have worked more than 10 countries, including Africa. But this girl, how she does, because she can't write the records. I observed she did perfectly correct RDT and perfectly counted the drugs and gave. I didn't talk because I pretend that I am a Filipino. Because I thought that she will scared. So I just observed. So this is 6 kids, and this is the commitment of those people, they want to eliminate because they are the one who's getting malaria and they know why. So this is how we are, what she is talking about. So like that, we have a lot of women who can make a difference in these societies, given the chance, given the right training and the capacity building.
For sure, a lot of good stories. And in fact, in my, privileged speech in the Senate yesterday about International Women's Month, the 3 themes of how we could fight back were all about stories, that stories matter. And then even the stories about the little and right now invisible things matter. And the stories that we tell, not only our little girls, but also our little boys matter. Because there was an earlier call to the men that you must also be part of women's struggle by using your male privilege as a platform one last time to stand with women and then dismantle that platform and unlearn the macho traits that have been passed down from generation to generation among boys and men. So really stories. And I think when we ask how do we remember and write more of and amplify more the stories of women in public health, let's create the moments to create those stories in all the spaces we are. I always say that everything good, also everything bad, but certainly everything good starts in the home and with the family. So how we raise our daughters and our sons. And then schools. Yesterday I was at UP Diliman for their launch of the Safe Schools project. Galing. And they were talking there among different universities and college student leaders gathered there, how even if the homes of some of their fellow students have become unsafe spaces, how to mobilize in the schools. And when they are able to achieve a certain momentum, that can overflow back into the homes and then outwards into public spaces. And so we got to talk about safe spaces and what, say, students in UST are doing, talking with the eating places and even the drinking places around España to also stand up as safe spaces for students. And if we can do that, if those young people can do that in the safe spaces advocacy, we can also do that in the workplaces as well for public health, to keep telling and retelling and creating new stories of women in public health.
I think that's the best to close this panel discussion. I would like to thank our esteemed panelists, from Dr. Ruby Constantino to Senator Risa Hontiveros, to Marvi, Trudeau, and to Dr. Gawrie Galappaththy. Okay. And to our those who participated in the audience for their questions. I think I would like to thank you for giving us a good discussion.
So thank you very much, Dr. Nicodemo. So I think it was a very fruitful discussion, and indeed, women in public health conquered COVID 2019, and we won for now.
Now, first, our privilege and pleasure to co-host this event with Spark Philippines, APLMA, and APLMA. The UP College of Public Health, of course, is part of the National University. We are a Southeast Asia Ministers of Education Regional Center for Public Health. And we're very proud about that. Again, pleased to co-host this event, co-organize. It's obvious, no, this is just the start. There are things we need to continue to talk about in the near future, okay? Not too long from today. The College of Public Health joins the nation and the world in the celebration of National Women's Month, International Women's Day. I like the topic today, women in public health. As you see, I am not a woman, you know, but you question in the forum today, where is gender equality? All female speakers. So I am the balancer, no? I am providing a bit of a balance, but I'm a staunch supporter of women. No? All of us love our mothers. All of us love our lolas who serve as mothers sometimes, our titas, our ates, and we know for a fact it has been mentioned in the discussions this afternoon, the critical role of women in public health and making a healthy family and towards a healthy nation. Public health, as you know, is a multifaceted thing. No? Marvi talks about the challenges related to malaria. It's not as simple as why do people don't get diagnosed and why do they die? No? And it's a multifaceted thing. And we've seen the crucial role of women in the far-flung areas, the hard-to-reach ones. Women, in fact, are not just responsible for getting a loved one or family member diagnosed and treated, period. We've heard about women responsible for patients, members of their family complying to treatment. It's not as simple as take this drug for a week, take this drug for TB for 6 months, and the patient stops the medication and he doesn't get well. No? Women, mothers, our caregivers who are women allow us to comply to treatment. Women are instrumental in helping prevent illness in the future. That's public health. Women working towards acceptability, submission to public health interventions. And we know, Director Ruby, the huge investments in public health of the previous and current administration. The biggest budgets in DOH now we are seeing. But it's a shame and it's a pity if mothers don't allow their children to get vaccinated. It's a shame and pity that mothers will not get their children dewormed. Senator Risa, our worminess as a nation, Gawrie will attest to this, is still huge. We belong as one of the top countries in the world that are considered wormy. And worminess is part of malnutrition. And stunting is 30% in less than 5 based on the national survey of the FNRI. We are the highest in Southeast Asia. Can you imagine that? So we can talk about a nice economy, but if your indicators are such that there are people, children, women left behind, no, we have not achieved our goals. Highest TB in the world. No? And then you talk about the overlapping diseases. In the communities, these diseases occur together in the same people, in the same communities. TB and worms. No? TB, worms, and malnutrition, all in one patient, all in one community. There are many more areas where women, and of course, the partners, no, will not have to be left behind. We can do things together. Okay? And thus, we thank in a very special way, and I'd like to be more positive now, no, to the women in the household, in the communities, in the schools, in the universities. Very interesting, yesterday, our guest was Yusek Mirna Kabutahe, one of our finest alumni in the College of Medicine, one of our finest alumni in the College of Public Health. She graduated #1 in her Master of Public Health course in 1987, believe it or not. And she was our guest yesterday in our flag ceremony, where we actually invite outsiders once a month to help inspire us. No? And she really inspired us yesterday. She did research before she came here, and she realized that a majority of those in DOH are really females, vast majority, and a vast majority of UP-CPH faculty and staff are also females. I think it's the same also, Doc Lani, in UP Manila. It's mostly female. Our chancellor is a female. She could have actually represented women in academe and in public health today. No? Unfortunately, she was attending to an equally important matter. So today we featured and showcased outstanding women. No? And I like the choice of the speakers this afternoon. All of them in the service of our people, especially the poor and most vulnerable, that whom we should really prioritize. With Senator Risa, the highest level representation of women in Congress. And let's take advantage of this opportunity while she's there. How I wish, Senator Risa, that you were Committee on Health Chair. Because we could have done, we could do much more. No? Immense, talagang endless ang possibilities. But we hope for better times. And yes, and hoping to be delivered sooner than later. No? Better times hopefully ahead. We've heard 4 other speakers, we're missing one of them now. All of them in public health and trying to enhance health service delivery, especially in underserved areas. Many thanks, Senator Risa, Director Ruby, Dr. Gawrie, Ma'am Marvi, and of course we're missing Ma'am Jordan. We missed Chancellor this afternoon. She could have been also a major contributor in this afternoon's conversation. So you've heard women who have proven to be much, much more than themselves, no, going beyond themselves, and I call that greatness. No, and thank you for showcasing this afternoon. So we've heard about gender inequality and the need to work towards gender equality, and we have seen sequelae, models, etc., etc. What needs to be done? And so the UP College of Public Health, and hopefully with our partners, will pick up this challenge. Because we're an academic institution teaching, we have to infuse gender equality now in our teaching. This comes at the right time, Doc Lani, because our curriculum here in the College of Public Health, which is a center for Southeast Asia, is undergoing a massive updating and revision. And so we will see to it under my administration that in teaching, we will talk more about being gender sensitive. I take the challenge of Dr. Ruby, Director Ruby, that we will help hone future health professionals who are gender sensitive. Now, we will be serious about this. Doc Cathy, nasaan ba si Assistant to the Dean for Academic Affairs? We will see to it na meron talaga ito. Baka nga dapat may elective pa sa MPH curriculum, alright, which is our flagship course. In the area of research, we pledge to continue to help generate knowledge, no, for improvements or enhancement of policy and practice. We will continue to work with DOH and other allied agencies. We're working very heavily with DOH nowadays. We're working very heavily with DOH. No, ang daming requests sa amin, Senator Risa, ng DOH, more than ever. But thank God, no, they are actually infusing lots of resources to CPH now. So expect massive growth, no, in the coming years, no, together in service of this nation. We want to do a little more research on engendering, Doc Lani, engendering health-related sustainable development goals. Kasi dito sa CPH, kasama na po sa aming thematic areas in our Master of Public Health, MS, and doctoral programs, the thrust towards helping the country achieve health-related sustainable development goals, including universal health care. No, so I think Doc Cathy, who's Associate Dean for Research, will make sure that engendering health-related sustainable development goals will become a research agenda under our administration. And lastly, in the area of public service, no, and extension as part of a national university, we will pledge to be part of advocacy. I think we have to do more work together, Spark Philippines, APLMA, NGOs like Shell Foundation, WHO, Senate, Senator Risa. We have to do a little more work together. Advocacy, CPH, providing the stage, no, for some of these discussions. Today, it was a small room, but I can envision it can be a bigger discussion that will be more inclusive and that will come up with concrete results after the conversation. I don't like talking and conversing only. No, I want conversations that lead to fruits, and we will pick the fruits, no, after a certain time working on it together. So CPH, use us as our stage. Use this as a stage. Use us as your mouthpiece, helping tell the stories that matter, as mentioned earlier. Okay, there is much to be done, and of course, very difficult. We will not complain if there is partnership involved. Alignment and convergence are keywords that I use in our administration, so that we can actually continue to converse, exploring more work together, joint undertakings so that our outputs are jointly owned and we push together toward our desired outcomes. Our vision after this afternoon, think, say, and do gender equality. Now, we will not only think about it, we will not only talk about it, we're going to do concrete things not to demonstrate gender equality. So trust that UPCPH can and will work in close partnership with all of you, no exception. Department of Health, other government and non-government agencies, in pursuit of better health for all our people, especially those who are lost and least. We wish to be able to reach the unreached and serve the underserved. No? Thank you very much, and a pleasant afternoon to all.